Welcome to Disrupt and Discuss with your hosts, E and KayCee. A Reshape Ventures production brought to you by Just E TV and My Herba by the Fitness Collective. Now, without any further ado, disrupt and discuss.
Hello, everyone. Welcome.
Hey.
Welcome to Disrupt and Discuss with E and KayCee, the podcast where we break down modern challenges and explore actionable solutions. I am E.
And I'm KayCee.
In this episode, we're exposing the intricate and often shocking world of plastic surgery. From tummy tucks to Brazilian butt lifts, from the rise of male patients to the dark side of medical tourism, we're unpacking it all. We're calling this episode Snatched, Sculpted, and Obsessed, the plastic surgery phenomenon exposed. Let's get into it. So, here's the question. Why does the Brazilian butt lift hold the title of the deadliest cosmetic surgery? How is AI reshaping future enhancements? And what's really happening in the underbelly of international surgery tourism? Those are the questions that we hope to answer with you today. All right, let's get into it. Let's talk about the origins of plastic surgery. So I didn't know this, of course. We gonna doing our research.
We're going to figure it out together as we go.
Right. So I didn't know that the historical perspective of this is that plastic surgery dates back to 600 BC before Christ in India. Yeah. Had no clue. I'm thinking, it's going to say 1920s, something like that. 600 BC in India, where reconstructing techniques were used to restore like nose injuries or as a form of punishment, which is weird that plastic surgery would be used as a form of punishment. But that's what it said, you guys. Let us know in the comments.
So bad that you...
Right.
Yeah. Okay.
So I guess they were saying they restored the nose after there was an injury or some type of punishment. They would restore that reconstruction of the nose.
Okay.
So you got punished, pop, right in the nose.
Makes sense. I'm like, God, you're going to sew my mouth shut.
Right?
I mean, what do you do?
Sounds awful. And then they said during World War I, reconstructive surgery made groundbreaking advances, helping disfigured soldiers regain functionality and confidence. So again, had no clue that they were using reconstructive surgery in World War I. But what they said was groundbreaking advances. So that kind of makes me like wonder, were these World War I surgeries, were these people a part of some type of experimentation? Maybe because they said groundbreaking advances. Did you utilize them to create these groundbreaking advances? I don't know. I'm gonna leave it alone.
These World War I vets that they were experimenting on.
Exactly. It sounds kind of Tuskegee-ish to me. When I read that, I was like, groundbreaking. Okay. All right. So this is what we're finding out. And now we're looking at the cosmetic boom. At the mid-20th century, as you guys know, plastic surgery shifted towards just aesthetics with breast augmentation, getting little enhancements, get a little here, a little there, leading the way to today's procedures, which has evolved into a whopping $55 billion global industry. That's a lot of money. So let's talk about it. Let's talk about the first topic, tummy tuck.
I know.
Let's go.
Okay. A tummy tuck or abdominoplasty, for you that know or don't know, it removes excess skin and fat while tightening abdominal muscles, creating a flatter and more toned midsection.
Yes. I want
Mm,
one.
girl, let me tell you. So some of these things that I've done, I've, come on the other side, come out of the other side of it, and I had it, done, ooh, maybe about 7, 8 years ago.
So let's talk about tummy tuck realities.
Oh, wow. That is my reality. So, a tummy tuck or abdominoplasty, as some refer to it as, removes the excess skin and fat while tightening the abdominal muscles, creating a flatter and more toned midsection or stomach. So, walking around with a flat stomach. And yes, I've been on the receiving end of one of those, and I am still very happy with the results.
Uh,
Oh,
she
it's
has a
fabulous.
nice little picture. Couple of pictures that I have of you that I'm ready to get on the table,
Yeah.
but I'm
Yeah.
scared, y'all.
And well, the recovery is about, but for me, about 2 months, about 6
Okay.
weeks, really, and then after that, I was able to go back to work. You
So
know,
what
it
does it
it
enotail? What is the procedure? What do they
well,
do
I
to
mean,
you?
well, as far as what they actually do, like, for myself, I had lost a lot of weight,
Mm-hmm.
and so I had that, I don't know if it was called the fupa or just the saggy stomach, worked out, didn't matter, still had it. So what the doctor did for me was, because I had a C-section with one of my
Mm-hmm.
daughters, the doctor tightened my abdominal muscles and got rid of all that saggy fat. And my
Okay.
stomach was taut. I mean, it was taut. So for the first week, I was hunched over. I couldn't stand straight up. And because they made it that tight, and then as you started to stand fully erect, your stomach
Mm-hmm.
got actually flatter,
Okay.
and so it looked good. And of course, the recovery for anyone that's had it, the recovery was long. It is one of the most dangerous surgeries to have, but the results were fantastic. You have to really search out your physician, look at their credentials. You want to see the work they've done. If you can speak to past patients, I checked the license and everything. One of my friends had recommended him. She had already done her due diligence, but she was saying, "I wanna make sure that you did your due diligence. I want you to tell me something about him that I don't know
Mm-hmm.
in regards to his background or the work he's done." She didn't want me to just go off of her recommendation. So I went and had that done. The recovery period, like I said, was about 6 weeks. It was painful. I had pain pills and utilized them accordingly.
Right.
But now, and of course, you have a bikini scar. And so what I opted to do was get it tattooed. So now I've got like a string of flowers around my waist.
It looks so
And
cute, you guys.
and the scar itself is the branch. I mean, this guy did a good job.
Right. I've seen it. For those of you that have not seen it, it looks really good. It's really cute. Very artistic.
So yeah, and aftercare is definitely key. Want to make sure that you're going to your checkups. If anything is out of place, anything isn't right, he was able to answer my questions. His assistant was there, everything.
Okay.
So I'm more than pleased.
And yours is more unique. Well, for me, it was more unique because I'm always, when I look at or I watch about, tummy tucks or the procedure, it usually your aftercare is in a hospital or at some type of location adjacent from the
Mhm.
surgery center, right? Yours was a bit different. Can you talk about that a little bit?
Well, one of the things that we had was in and out surgery. Went
Mm-hmm.
to a surgery center, was there first thing in the morning. By early afternoon, a nurse brought me home. That was part of what we paid for. So the nurse comes to your home and stays with you for 24 hours. In preparation, I had a hospital bed because I have a two-story home and I wasn't going to be able to go upstairs for a while. So had the hospital bed, the nurse there for 24 hours to make sure that there weren't any complications. She went over the pill schedule with my husband, and how to clean the dressing and everything. I had drains. He had to learn how to do that. And I know he's like, I did not sign
Sign
up
up.
for this. But, and then he monitored my medication because the medication I had was highly addictive. I would say it's time for a pill. And he goes, well, are you in pain? And I'm like, it said every 3 to 4 hours. That's not what I'm asking you. So
Right.
we went back and forth a few times with that. But, and I had a corset for a while, and I
Okay.
forget the actual name, but to keep everything in place. And, because I
That
had
was
to
one
go
of my
back to work.
questions. It was kind of like one of those, was it a corset or was it like one of those fupa suits?
Mine was like a corset. Now you could have a fupa suit, as you call it, but
Mm-hmm.
you have drains in the beginning.
Okay.
So, I had something that was wrapped around and I was able to put the drains and attach them on the outside. But if you got a full suit, that's going to be kind of uncomfortable.
And then you said you got a hospital bed. Did you purchase a hospital bed or did you rent one?
No, I rented
Okay.
one. There's places for everything. Oh my gosh. So, and then the doctor's office, they let you know that you don't have to go with these people, but this is a start.
Hmm.
They're familiar with us and everything. So yeah, so I had it for like 30 days and I really didn't need it after maybe 3 weeks or so. I was getting bored and I hated laying down. So I wanted to sit up for a while. And then slowly but surely I remember going to the grocery store and the walk was just so much. I got tired and I had to go back and lay down.
Hmm.
So just building up your stamina because again, that has taken a lot out of you and you're constantly healing at the same time. So just being still in order to heal was another thing. And going to the bathroom was a challenge. That was like, do I really got to pee?
She said, do I really have to? Or can I
Yeah.
hold it?
Yeah. Yeah.
Okay.
So,
So
but I'm happy.
she looks good, you guys. Maybe we can put some pictures up.
But I will add that one of the things my doctor had said beforehand, don't think just because you got it that you don't need to work out, you don't need to watch what you eat because
That's good.
granted, he's taking excess skin and fat. So you might not get that fupa or that fat stomach, you'll still be flat, but that fat is going somewhere else. It's going
Right.
somewhere else in your body.
Now, is
So,
that from the surgery or is that from the lipo?
well, no, no, no. This is
Just in
you
general?
when you start to gain weight. If you were one to really gain it in your stomach, the fat around
Hmm.
your midsection is gone.
So it
So,
redistributes somewhere else.
well, no, because he's literally taking that skin away to make it flat. So the fat that was in that skin, that's all gone.
Okay. I got you.
So, but if you still go and jump into a box of Krispy Kreme, you're going to gain weight.
Right.
So where is that weight going to go now? So you have to be mindful that you might start gaining weight somewhere else because where it used to go in your stomach, now it's not traveling somewhere, but the other parts were getting fat too. Now it's really going to get because fat is really going to pick up.
Wow. Yep.
So I had to be mindful of that. So, I try to work out and watch what I eat. And sometimes it just doesn't happen that way, but that's what you got to do. So you want to maintain it. You don't want to just go and have them do it and then you keep the same lifestyle that you had before, which I know people that every so often they go and get lipo and then they're fine and they go on with their daily life.
Right. Now, so basically, what you're saying, you should not use that as a replacement for lifestyle changes and
Oh,
exercise.
for sure. Cause you want to keep it. You know, paid this money, you've gone through all this healing process and you want to ruin it. I mean, nobody is perfect. Yeah, I like my sweets here and there and a little drinky drink too. But at the same time, I have to be mindful. I don't want to look like I do that either.
Right.
So I go and work out
Try to
and
maintain. I love it. So you said downtime is usually like 4 to 6 weeks, right?
correct. Was
Did you
able
see the results, the full results, when you were like, oh, this is it?
probably for 8 months, 9 months. You're gonna see immediate results, like, you're not gonna see the hanging skin anymore.
Mhm.
You still have to heal not only externally, but internally, and you still have a lot of swelling. Any type of surgery like that it's gonna be there's gonna be immediate results, but then to get that perfect, damn, it's going to take, I would say, after a good year, you'll look like you want to look. You'll be healed way before then. But to not have to worry about putting on the corset, making sure that your scar cream is on the way it should be, all of that. Because, even though you're able to go out and do what you do, you're still healing.
Right. I like it.
Yeah.
Okay. This is a surgery that I'm interested in, but KayCee always talks about just do it. And I'm like, I want to, but I'm scared.
Of what? Of
Going into the knife again.
all I would say, anybody that's interested, at least get a consultation. Then your questions can be answered. And you can either say, I still want to do it, but not with this doctor, or I
Right.
want to do it and I want to do it with this doctor.
I'm thinking about it. I have not had any cosmetic surgeries yet, but I do want to do it. And we'll segue into why I need to do it right now. So the next one that we're going to talk about is bariatric cosmetic surgery. KayCee spoke to hers because she's gone through it. I am a bariatric patient. I am post-op 13 years. So I'm going to talk about bariatric cosmetic surgery. So basically, when you have bariatric surgery, there's three very popular bariatric surgeries. There is the Roux-en-Y, which is the routing of your small intestine and cutting your stomach, making it less than an egg size.
Wow.
Then there is the vertical sleeve. The vertical sleeve is the one that I had, and that one is no rerouting of your intestine. It's just cutting your stomach into, it's more like a cylindrical, kind of like a very narrow, like banana. But again, it's small. Your stomach is small. And so what they're doing is they're cutting the ghrelin out of your stomach, which is supposed to be where they say that takes away your appetite. It's supposed to curb your appetite, or makes you not really crave the things that you crave. It works for some it doesn't. But that's bariatric surgery. The final one is not as popular, but some people still get it. It's like a band they put over your intestine. All of these are laparoscopic surgeries that they do. And when you do have bariatric surgery, you experience massive weight loss. A lot of patients also deal with excessive skin, which causes physical discomfort and emotional distress. If you're talking about someone who was 500 pounds and now they're 180 pounds, that's over 300 pounds of weight loss. When your body is stretched out that wide and you lose that much weight, you have a lot of loose skin that can cause irritation. It can cause smells. It can cause discomfort in some cases. So that's when cosmetic surgery comes into play for a bariatric person. For me, I only lost 155 pounds. And
Only?
yeah. Well, I say only because I know someone that has lost 300 and something pounds. So I'm like, well, I just lost 150, but I still lost a whole person. In hindsight, I was 300 pounds and I lost 150, 155. So yeah, it absolutely, but I don't have as much excess skin, but I do. I have enough excess skin for me that I don't like it. Also, I had a C-section. So that lower, what do you call it, the fupa, once they do that C-section, when they cut that muscle, it's like no coming back from that. When I got it done, it was 20 something years ago. My son is 23. They didn't give me anything to like, I guess now they give you like that fupa jumpsuit in the hospitals to kind of hold your stomach back in place after you have that surgery, after you have the
Yeah.
C-section. They didn't give me
My
that.
kids are older than yours, so
Right. They didn't give me that either. So you got sewn back up. They let you stay overnight. You went home after one night stay,
yep.
and that was it. I had to use this breather thing to make
Yeah.
sure my lungs didn't collapse, blowing this tube to make this thing go up. I had a major surgery, but that was it. So
Wow.
I'm walking around with, I didn't have a belly But now I have this lower belly. I went from having a flat stomach to a lower belly. And no matter how much you work out, no matter how many jumping jacks, high knee lifts, and all that, it don't go away.
No, you'll have a six pack underneath all
Right.
that fat, but you
Right.
won't see it. Mm-mm.
You won't see it. Exactly. So
Yeah,
I don't
yeah.
see it. So that's why I want to get the tummy tuck. I just got to talk myself into it, y'all. But
Knowledge is power. So
yes,
whatever you're thinking, whatever your beliefs are, and it could be 100% right on the money, but at least talk with somebody who does these. You can have your questions answered because that, I mean, I think a lot of the people that I have spoken with were like, I don't want to be put to sleep. I'm not going to lie, that was in the back of my mind. But at the same time, I go to sleep every night. I won't wake up, then. And
perspective.
yeah. And then again, as we all know, the TV show, people watch Botched. And some of the people, if you really look at the show, there were red flags from the word go.
Correct. Correct.
If you're gonna do surgery on me and I show up and you got me laying next to a block of ice, I mean that's a problem.
Right. Exactly.
Then come to find out some of these doctors
Or dentists.
malpractice suits up the yin yang, and it's like if you do your due diligence, and I know there's always exceptions, but you try to mitigate as much as you can. And you go with your gut. If something ain't right, it ain't right.
Exactly. And that's all I need to do. I need to settle down and just do a consultation and get my feet wet. And once I get my feet wet, then I'll get going. But I've avoided getting my feet wet,
Yeah.
not going down the rabbit hole.
Well, no, that's perfectly fine because originally I wasn't planning to get a tummy tuck. It was either going to be cool sculpting, tummy tuck. And I didn't know what the differences were, besides one being under the knife and the other not. I had a consultation with the surgeon, and he said, for what I'm looking for, cool sculpting isn't going to give you that. I wanted the flat stomach, all the bells and
You
whistles
wanted
that
all
went
the
with
bells
it.
and whistles. Yeah.
Yeah. And so he was able to provide that, whereas cool sculpting wasn't able to. And that's how I knew the difference. And it's like, damn, I went through with it.
Right. I'm going to, we'll see. I'm going to get
I'll
there.
pray for you.
2025. Y'all
Okay.
might be surprised.
All right. Put that on your vision board.
Vision
Okay.
board.
Now.
Yes. But you guys, that's the reason why I'm a bariatric patient post-op. But let's talk about the most popular procedures for us bariatric folk. So the most popular ones, of course, is the body lift, because like I said, excess skin. So tightening and removing all that saggy skin on the abdomen, thighs, and buttocks. And a lot of times for these procedures, well, let me get through this really quick. Arm lift, which is I think it's branchoplasty that targets the loose skin right here in your arm. And this, oh, you guys can't see me on the audio, but for the video, you guys can see me. So this part right here is usually a lot of saggy
What do they
skin.
call those bingo arms?
Yeah, yeah, low wings. You know, you usually have a lot of that. I don't have as much. I have some, but it's livable to me for right now. And then your thigh lift. So that inner thigh, and that's where there can be some rubbing that can get painful for a lot of folks because that skin has sagged. They have lost all this weight. So it's uncomfortable. It can also cause rashes, burns. It can also,
Oh,
cause
wow.
smells. So you have to get these types of things done because it's cosmetic. A lot of times your insurance won't pay for it. So it's going to be out of pocket for you. The only way that they will pay for some of these, and I've gone through bariatric support classes, there's cosmetic surgeons that come in and talk about this. The only way they'll pay for it is if there is a medical need. If that loose skin, that flap is your stomach, if it's so massive and like I said, it's causing pain, it's causing rashes, it's causing a smell, things that you can't avoid, you can't do anything about, and it needs to be removed to relieve those things, then that's a medical need. They'll pay for the removal of the skin, they won't pay for the other portions of it. So, with regards to that tucking of the tucking it down type of situation, they don't pay for that. So they pay for the removal of the skin. Those are things that you need to understand when you're looking at it. When you're dealing with bariatric, it's a lot of out of pocket cost
Wow.
unless you can provide a medical need. Your healthcare provider will pay for it.
A quick question. I remember when bariatric surgery was really new. It was way a while ago. And one of the ladies on there was saying, okay, now she can't eat like she used to.
Mm-hmm.
So that addiction is still there. And I don't want to say addiction, but the hunger or just having to do something was still there. So then, unfortunately, she went to drinking.
Mm-hmm. Yep.
And I was like, wow. And again, here we go with the mental part of it. You've been longing to get this done, not you personally, but longing to get
Right.
it done. And you realize that your vice, however you want to look at it, is no longer there for you. So is there some sort of counseling that goes along with what you're having done so you don't start looking at these other vices to kind of get back in a situation that you just got out of?
That's a great question. You always have to see a psychologist before the surgery because
Oh,
they have to deem you mentally fit to go through a surgery like this because it is a tool and it's something permanent being done to you.
mm-hmm.
But if you don't do the right things, if you don't plan, if you don't utilize the tools that are given to you, like exercising and the ability not to eat so much, then you can still get fat, even with that small stomach. So, yes, you do go through a psychological profiling or survey evaluation to make sure that you're in the right mind state. But a lot of people understand how to, say what they need to say to get
Mm-hmm.
to what they want.
Absolutely.
When you have that surgery, a lot of people are addicted to food. That's the reason why they're big. And you can't eat the way you used to. You can start having you can pick up other addictions, like she said, alcohol, drugs, painkillers, gambling, sex addictions. There's all different types of addictions you can pick up because now you can't deal with your depression or your anxiety with eating anymore. You can't adapt another vice. It's all about mindset. A lot of people don't set themselves up for success. You really have to understand what you're doing, why you're doing it. It's a lifestyle change. It's not anything temporary. This is
Right.
going to be your life. People can even get addicted to exercise. But it's an addiction. They go from one vice to another, but that's just their I guess their what do you call it? Their mentality. You're supposed to be able to catch that, but sometimes it goes on through the cracks, and you do get people who deal with that.
Wow. So how were you able to not fall into those traps? I mean, on the outside, you look great and you seem like you got it all together, but I don't live with you either. I mean,
Yeah,
in all honesty. So
yeah,
I don't want to assume that, oh, she's looking all great. She's got it all together. And you know, as well as I, we all can look and do what we need to do.
absolutely.
But when you're by yourself, you're by yourself.
I would say for me, I didn't pick up any other vice as far as drinking or doing any type of hard drugs or anything like that. I always still have my greedy girl issue. So I'm always gonna sometimes you can see food and you're like,
Hmm.
oh, I want that. And you can make a big plate and only eat like 3 bites. But I still have that greedy girl issue.
Okay.
But I don't try to force it. So the problem comes in where even though your body is telling you no, you can't take anymore, you're still trying to eat it. What helped me stay grounded was to stay in support groups. I still go to the bariatric support groups after 13 years
Oh,
of being post op. We meet once a month, second Saturday of the month. It's usually in person or Zoom. Before the pandemic, it was in person. After the pandemic, it was Zoom. Now, the last year or so, it's been either or. They rotate. If it's in
hmm,
person one month, so on Zoom another month. So they keep it a constant rotation. That's what really helped me to stay grounded because I still see myself as a bariatric patient. I don't deny that I had the surgery. They give you tips and tricks and they talk about, depression. They talk about stress. They talk about how to deal with certain things like that. And so that's what's kept me grounded, to be around people are who went through the surgery, who have been successful, and other folks that have been unsuccessful. Believe it or not, there's a lot of folks that had the surgery and they're still struggling. They've only lost 50 pounds and they needed to lose 250 pounds. I keep myself grounded. I keep myself around folks that keep me mindful of why I did what I did.
Oh, accountability partner, if nothing
Yes.
else. Because to me, you look fine, but somebody that also has gone through it, they could see the pitfalls, they could see the triggers or see what I can't see. I'm just like, oh, girl, you look good in those jeans.
Right.
You and you're like, but I'm
Right.
dying on the inside. And I wouldn't know. I really wouldn't
Right.
know.
Right. Not dying on the inside, but sometimes you do get, I'm
Okay,
like,
that was a little
dang,
dramatic. Yeah, I know.
right.
But
Right. Sometimes I'm like, dang, I can't eat a whole burger at one sitting, but that's a good thing that I can't eat a whole burger, because one burger sometimes led two burgers, and
okay.
also, a 20-piece nugget and a big old drink. I'm
Right.
happy that I can't do those things anymore. It's a mind shift, and I say it like it's nothing. It's really something. You have to get a hold of your mindset and why you're doing what you do.
I mean, this is so foreign to me. I mean, really,
Right.
it is. So it's like, wow, okay. I know of people that have had it done, but it never sat down and had an actual conversation about it. So, I mean, I'm learning something. What I knew, you can put on the head of a pin, and that wasn't too much at all. So wow. Have you been like, not so much as sponsored, but have you given talks or taken somebody under your wing and, hey, you can get to this point by this time period if you stay the course kind of thing?
I have done talks. I have spoken at a couple of our support groups before. I did it after my 10th year because I felt more confident about it. I
Mm-hmm.
felt like I made it through 10 years because for me, it was my fear was, oh crap, if I get this done and then I gain all this damn weight back. It was a fear of mine. So I lived under that for a good 5, 6 years. I look good, but what if I gain all this back and then it's for naught? The people that know that I went through this surgery, then they're going to be like, see, you should have never did that mess. You couldn't handle it. So I put a lot of pressure on myself to be successful in it.
Well, it even brings up another question. I'm sorry. I got these questions and then I'll move on. As far as the people that were with you when you were still thinking about it,
Mhm.
vacillating on the subject, then you go and do it. They're seeing the progress, you're seeing the progress. Those friends are no longer here. Not necessarily an enemy, but they just
Right.
faded away because maybe they were used to being in the forefront. Now you've got this whole new persona. Not bad at all. I'm just saying now it's like, hey, look at me. Or you just
Right.
walk in like, God damn it, look at me. And people can see that
Right.
when you
Right.
walk in a room, no matter how big or small, because there's some big people that are like, damn, you command this shit.
Absolutely.
But because of all of that, they just kind of faded away. Or have the main ones really stayed?
For the most part, the main one stayed. I only had one person really, what they said to me triggered me a little bit, I guess you could say, or
Mm-hmm.
it hit me a little bit different. This person I had been around, and she was a big girl, and I was a big girl. For some clarification, I wasn't big all my life. I went through a 10-year spurt of my life where I ballooned up because of pregnancy complications and dealing with my son who had some issues after that pregnancy. And I stress ate to the point of I didn't care about myself at that point. I was too busy caring about my child. So I consumed food as some type of comfort. And that's how I ballooned up to 300 pounds. It was a stint of 10 years of my life, and I got that big. But to answer your question, yes, we were both big, even though she was very encouraging. We used to do a lot of weight loss camps together, colonics,
Oh,
detoxes,
oh,
all types of stuff, all types of fasts and all that stuff. We were locked in, we were buddies with this. But then when I decided to go and have the surgery and I did it, she was a little bit apprehensive with regards to it. And she was like, "Are you sure you want to do something like that?" And I was like, "Yeah, well, I've done pretty much everything, cabbage soup diets and all kinds of craziness. And it's
great
not, I'm
stuff.
only losing like 25 pounds and then I'm gaining it back and I'm gaining an extra couple of pounds
Right,
with it. So it's not working. Or I'll go hard in the gym and I injure something, my knee, my back, something, and then I'm knocked out for 2 years, so 2 weeks, and then I got to start all over. So it was
right.
like a never ending cycle, and I was tired. I researched bariatric surgery and I found out that it's a long story, but long story short, I got the vertical sleeve, got that surgery, was started being very successful in it. After the first few months, I dropped like 60, seventy
Oh,
five
wow.
pounds. So yeah, you could notice the difference. And she said something to me that really put me, I was like, dang, I didn't expect this from you. She said, and people were congratulating me and things of that nature. She was like, "You look good." She was like, I'm still on my journey, but I want to do it God's way. I want to do it the right way. Like,
Okay, okay.
I was like, "So are you insinuating that I took the easy way out?" By no means was this easy. And anybody who's gone through bariatric surgery, this is life altering. You can't go back. So, yeah, she said that, and I was like, wow. I just never thought it would come from her. But now
Yeah.
that person, rest in peace, she's no longer with us. But yeah, she said that to me, and it just really made me look at her differently. Like, this is what you think. You think that I took the easy route, even though I'm working out every day. My eating habits
Mhm.
have to change because I can't eat that anymore. That is not the easy way out by any means. I did have one person that it really affected me what she said
We've all had those. They're with you until they're not.
until they're not. May she rest in
Man,
peace.
not only women are obviously entrenched in the cosmetic surgery arena, now men.
Yes.
Now
Yes.
they've been doing it, now they're actually being talked about doing it because
They're
they
letting it be known.
yeah,
No
for
more of
sure.
just surprise like Sylvester Stallone. Who else do I know that, it's so apparent that they have had some type of work done as a Hollywood star.
Some looking like, "Huh?
Right.
What?" It's like,
Yes. They're like,
or,
they just,
"Huh?" You know?
right. Pull back. And do you know that and people, when I say this, people are like, I don't remember him talking about it, but Dwayne The Rock Johnson had his pecs removed at one point,
No,
and
I didn't
nobody
know that.
remembers that. He had his pecs removed because they had gotten so big, and I don't know if it's because of his workout regimen, because some men have those big chests when they lift weights, and he didn't want that anymore.
Yeah.
He had them removed, and then now he has them back again. So I don't know why he did it, but yeah, he had those removed at one point.
Wait a minute, wait a minute. I'm thinking 2 different things. You're not talking implants.
No,
Okay, okay,
he didn't implants, but he had his
okay, that makes sense, I get it. Well, social media has definitely fueled it. I mean,
yes,
come on, the
absolutely.
anything, everything is on social media. Among men to maintain their youthfulness or to be spry. It also gives you a professional edge. There's some newscasters I've seen over the years, and
Mhm.
like, something looks a little bit different. A lot of these procedures are such that they're literally little nips and tucks where your downtime is hardly at all. So you can
Right,
go on and get this stuff done.
exactly.
Instead of going on a vacation and going to get it done. You can just get it done on a Friday, and maybe the following Friday you go back to work. because of
Right.
swelling, and you got makeup. So it covers it all up.
It's funny to me because they talk about women being so vain and always going under the knife. But now you see that men are going underneath the knife in droves now. It's increased.
Yeah. Because it's become acceptable, and not to the extent where it is for women, but I know, like, for example, even though my husband didn't technically have plastic surgery, he had a mole
Hmm.
on his forehead, and he was going to go to our normal, air quote, normal hospital, the major hospital out here in our area. But instead, he also went for a consultation with my doctor.
Right.
And my doctor was seeing the differences. Although the hospital that he was going to go to, they would still do a good job. However, he was going to go deeper in the skin or dermis, whatever you want to call it, because I'm not a doctor,
Right.
and remove the mole. And because he was a plastic surgeon, the stitching, you would not see it. My husband is bald, so if he had a scar, you would see it. And he went in and had it done. Sometimes the moles, if you don't get it deep enough, can come back. You could not tell where it was done, and he got it removed.
I
Dr.
gotta talk to your
Goody.
surgeon. I gotta talk to your surgeon.
I didn't tell you that? You didn't know that about Aaron?
No, no, I
Oh,
didn't. Every
yeah,
day.
yeah. He went and had it
Okay.
done.
So we talked about the stats, and they said male cosmetic procedures have grown 325% since the 90s, since the 1990s, with Botox seeing 20% year over year increase. Men are getting Botox.
My
She's like,
husband isn't. I kept saying, babe, you want to go? He goes, let me get this straight. They're putting a needle in my face. Yeah. He goes, fuck no, I ain't going.
I ain't gonna get that. Okay.
Oh, I'm not going.
He's good.
Although Aaron's wife does.
KayCee does, she has the corner market on certain things, and I have to ask her because I'm like, I want to do it, but then I'm nervous about doing it. And then I'm scared that if I do it and I like it, am I going to get
Okay,
addicted?
now that I can't help you with, because it
Right.
is going to probably happen. One of my friends went to get, she had lock, I guess it was not so much locked jaw, but she would always have TMJ. It was recommended by her dentist that she should get Botox for the TMJ. She and I were talking about that. I said, nothing against your dentist at all. I'm sure that is the best dentist on the market, but there is no way I'm going to have a dentist give me Botox. And the specific reason why, and I'm sure some dentists are like, oh, but here's the thing, you work on teeth. How
Right.
many Botox injections do you do on a day, a week, a
Correct.
month, a
Correct.
yearly basis? I go to somebody that's all that they do. So I might luck you as a dentist. You might give me a cap or something, but I'm not having that. And that's one of the things that, if anybody learns anything from botched, they've always said, if somebody came in and they had this mishap, which they always do, well,
Right.
my OBGYN said that they could give me a tummy tuck. In that respect, I use that as the same when I was telling my friend, I said, at least get a consultation. And this isn't with the surgeon, it is with the person that's what they do. And this is a nurse practitioner. And that day she was able to go and get it done by the nurse practitioner. And after that, she was good to go. And then her
Hmm.
problem that she said is going to be, oh boy, this is a slippery slope. This is bad. So
See?
then you start looking at other things. And not everybody is like that. I don't go, and you can't necessarily tell that I had it done,
Right.
but the little lines on the forehead, the crow's feet around the eyes. And I'm just talking about some minor things, not where you go and your whole face is paralyzed. But the only problem, and it wasn't even a problem, occurred for me during the pandemic because we were all wearing masks at the time. The forehead ain't moving. So you got this mask on and you've got this resting bitch face.
Right.
So you look like, I'm not speaking. So what I ended up having to do when I would go somewhere and I want to speak, because I know what it looked like, I would squint, go, "Hi, how are you?" And of course, nothing would move above my eyebrows.
Right.
And so sometimes people will think you're stuck up or something, but it's like, no, just the Botox. Yeah.
I love it. That's crazy. See some things in me in 2025. Don't trip, y'all. Don't trip if I look different.
You can do something. I mean, if that's what you want to do, if that's
Right.
what you want to do.
She's not pressuring you. She knows me.
There's no pressure in. If she ain't
No.
gonna do it, she ain't gonna do it. I can tell you that much.
Exactly.
But one of the things I did notice when we got on this whole subject is that in the doctor's office, there are also men coming out of there and they're scheduling their, monthly or whatever appointment they want for Botox. What I've noticed seeing a couple of them come in, it was mainly like for the forehead because there was a lot of lines.
Oh, those
Um,
lines.
uh-huh. So that's what I've noticed from where I go. I mean, I'm not in the room with them. You can see that that's probably what it is.
Interesting. Men, let us know. Are you comfortable with getting some Botox? Would love to hear from you.
Face.
The shot in the face. God. Oh, God.
It's a teeny, teeny, teeny little needle. You won't feel it. Really, you won't.
How long does that take before you see the results? Is it instantaneous?
No, it's not instant. So it might be anywhere maybe to 3 to 5 days. It's a gradual thing. It's not like you go in at lunchtime, all of a sudden, no, you're not. It's a gradual thing.
And how
And
many do you have to do it a year? Or what's
it,
the
again,
recommendation?
it would depend on you.
Okay.
I only go maybe every 3 months, and that's only for certain things. I might get my eyes, the crow's feet, and all it'll do is just soften the lines around there. And I might not get that done again for another 4 or 6 months. And then I'll go and get the lines taken care of in my forehead. And I might not get that done for another 4 or 5 months. But I go every 3 months and then we just say, okay, I just want a little tweak here or just a little something here. But it's not very often.
Okay.
And if it's something that is outrageous, she'll be like, no, we're not doing that. Even down to the surgeon, if there's something that you need to do on your end, for example, you might have to lose weight to get a tummy tuck. I don't know what the parameters are, but you might have to. He'll
Right.
tell you. And one of the other things that we're going to talk about is the Brazilian butt lift and just any of that. And he doesn't do that. He says that because that is so dangerous, so incredibly dangerous. He said, I'm not doing that.
That's what we wanted to talk about as well. I think we might have to do a part 2 to this because that Brazilian butt lift hit different. There's just so many different aspects of it that, like KayCee is saying, a lot of surgeons will not touch it. Would like to dig deep into that one because it's very popular amongst the ladies and some gentlemen.
Yeah. And I know we're going to table this and do it some other time, but when you get your butt done, you might want to make it in proportion to your thighs.
Right.
Oh my God.
Yeah.
God.
We've
And
all
then you
seen the
put
TikToks
on,
and Instagrams.
I've seen it in person.
Have you? I haven't seen
Yes.
them in person.
When I saw it in person, it looks so bizarre because you've got these stick legs and you've
Right.
got this butt. You look like a letter P,
Right.
It's like, what
That's
the
a good way of saying it.
hell?
You look like the letter P.
Yeah, it's just like, what the hell? Are you seeing what I'm seeing? Sometimes I'm like, no, they're not. When we talked about body dysmorphia, you don't see it. All you're seeing is that ass. You're like, oh, I look good in these jeans, but it's like, no, you
No, you
don't.
don't.
Your legs are too skinny.
That's a mental condition. I almost think it should be a crime that some of these doctors do this to women. It's clear that they have some type of body dysmorphia, some type of mental health issue to where you don't see what everybody else sees.
Ugh.
And some people keep doing it.
Yeah. And I haven't
Keep
had that
going
done,
under the
by the
knife.
way. So
Right.
I can't talk on
Full
that.
disclosure, she said, I ain't did that.
No, I haven't
ain't
had
did
that.
We're going to jump around because, like I said, it's a lot that goes into that one. I would love for us to touch a little bit deeper into that because it has layers that people are doing. It's layers to that I wanted to discuss.
Okay.
What about, let's talk about the micro needing. Micro needing.
Microneedling? Oh,
Yeah.
yeah. That helps to produce collagen
Okay.
in your skin texture.
I might
It
do
does.
this. I might do this one.
I've had that done too.
So what does it entail? What's the procedure?
It's a bunch of little needles, machine, and it just goes. And they'll do so much. They'll ice it. They'll do so much more. They'll ice it. They put topical numbing cream on you and
Okay. I
everything.
was
So
gonna
you're
say,
not.
does it hurt?
It doesn't necessarily hurt, but after a while, it becomes painful because you've been getting these little micro needles in your face for about 30, 40 minutes. It doesn't go really deep, but it goes beneath the dermis. And it's to get everything, the juices flowing, as I call it. For some people, it's minimal swelling. My face swelled up like a balloon because it was just trying to protect itself from what had just happened. Right when I had it done, I had to put ice packs on it and everything. With the next couple of days, my face was a balloon. It was huge. The area where it got done, but it went down. The doctor's office called to check and see how everything was going. I had some pain medication if I needed it, which didn't. It just was really swollen.
Really?
And that went down about maybe a week, something like that. No scarring, nothing like that at all.
Okay.
And, you go and get your facials and everything. I don't go as much as I really should, but I get them every so often. And just to make sure everything is good and make sure I do my skincare routines and stuff. And yeah.
And what about at home micro needling?
I don't know anything about that. I cannot stick myself with a needle. No, that's not going to happen.
I can't.
Mm-mm,
That's a no bueno for me.
No.
So-
And I honestly, I haven't done it, but I can't really say that if you got your little kit and did it yourself, would you do it correctly? How would that even work? Because my face
Right.
swelled up like a balloon, telling you. I'm not doing that.
Not the kid. Okay, what about fillers? Fillers, volume, shape, contour. What you notice I keep asking KayCee because KayCee is the subject matter expert on this one.
I'm not an expert. It's just I have dabbled a little bit.
She's gone where I have not gone before.
No, fillers actually, it's just what they do. They fill. And why I got some, and I'll explain where they are, it's not a big deal, is because I lost a lot of weight. My face, you can see it in your face. And one of the other things in our family, we have jowls.
Okay.
That's cute when you're a baby and you've got jowls. When you're no longer a baby, it ain't cute. Concealer can only conceal so much.
Right.
So what happened was I ended up getting some filler up on my cheek. Not a lot, but just to fill out the cheek and everything.
Okay.
So that was what I got.
She looks good. Well, if you catch the video on YouTube, you can see my girl. She look good.
It's work. Thank you. I'm learning to receive, but it's work. It really is. I think I only did that twice, and that's been a long time ago. A lot of people go overboard. It's like, that's an obsession. I want to look decent. Don't get me wrong. Some people could say I have an obsession, but if you want to see some improvements in yourself, go for it. Just like you said, your friend had said, well, I'll do it God's way. Well, I would hear, well, I'm going to just grow old gracefully. So
You do that.
I'm kicking and screaming and I'm fighting everybody. I'm doing the windmill. I'm fighting it every way.
They're gonna have to caveman me. They're gonna have to drag me by my hair.
Yeah.
No.
And that's the thing. To each his own. But like I said, I had lost a lot of weight and the face was starting to slide off.
Gotcha.
And I could really tell when I would put makeup on because things would be enhanced that really shouldn't have been. Like the jowls. You can camouflage it. There's tapes, all the kind of things you would see people. I even tried that. You put it like back here and you would pull it. And it don't work with locks, first of all. And one day I was down south visiting family in Florida, and it was one of those balmy mornings. So I come outside and I'm thinking, oh, I got it good.
Right.
My daughter said, Mom, what's all that shit on the back of your neck?
Oh my God.
I go, fuck it. I'm not wearing it. I'm not.
She said, what is that?
Yeah.
Busted you out.
Yes.
Oh,
That's my older one. So,
right.
and she, yeah,
Da-
you have to know her to know that. Ugh,
yeah.
mom, what's all that shit on your face?
You're
I
like,
thought I
oh
had
damn.
covered it up. I thought I had the lock over like this, and the face was
Right.
going like that. Man, I didn't even get 2 steps out the hotel. I went right back in
And
and
just
took it off.
have you ever
Yeah.
done any lip filler?
Oh no,
Okay.
no,
She said, oh
no,
no.
girl,
Mm-mm.
these are full.
Right.
No,
I'm comfortable with my lips.
when I start looking like a duck, then you can start
Right.
saying something, and that's one of the giveaways too. When it's like, you got duck lips. What's going on here?
Yeah. But don't go from duck lips to blow up doll lips. That's too
Yeah,
extreme.
right. Yeah, no, that isn't something. No Brazilian butt lift, no lip injections. Trust
Right.
me, that's not needed on this end.
No.
Literally.
Oh, yeah. It's not needed on that 4
A
foot
lot, but
11 body.
some of that is because I'm a power lifter. So
Yes.
I'm lifting.
Okay. I'm going to bust her out. You just started powerlifting a year ago. That
Yeah.
booty been with you since we was hiking. That booty been with you. Okay.
And anywho,
It's that.
what's the well, now it's
Okay. Don't
thank you
get it
very much.
twisted. Okay. Don't let her tell y'all that. It's been there. It's the weights. Okay. I think we're going to close this one out. We gave you guys a lot of information. We touched on men Botox fillers. We touched on needling. We touched on tummy tucks. We touched on bariatric surgery and what that entails with cosmetic surgery. We went through a lot. I think we're going to do a part 2 because we do have a few other topics to talk about, and I don't want this to go too far over. Let us know what you think in the comments. Have you ever had cosmetic surgery? I'm got bariatric on the mind right now.
Well, bariatric as well.
It is a cosmetic surgery. Yes, it is. Have you ever had any type of cosmetic surgery? Do you have a success story or a horror story that you'd like to share with us? Let us know in the comments. Anything that you think we missed with regards to this topic, we would love to hear from you guys. Always, we will be back with another one next week. Until then, until the next time, you guys. Bye.
Tiki Barber here. I remember those grueling practices, pushing through fatigue and striving for greatness. Well, that's the same dedication My Herba puts into their supplements. They understand the body's needs. My Herba takes a holistic approach to wellness. Whether it's their sea moss, immune defense, or even sleepy time, they have an option for you. Let My Herba make the best you with code BARBER10 for 10% off at thefitnesscollectif.com.